Okay, yeah, we're in our cosmetic procedure room, and what we're doing today is a procedure known as a Radiesse injection, and what might have been relegated strictly to chin augmentation as a surgical procedure in the past, we can now accomplish in a way that's minimally invasive using injectable fillers such as Radiesse. We have with us today a patient of mine for the last 5 years. This is Kim. As you can see, extremely attractive 29-year-old female. And we've actually performed this procedure before on Kim. And what we're doing here today is enhancing the aesthetics of her chin and the overall balance of her profile. What we're seeking to achieve is increasing her projection both in the frontal plane and also somewhat vertically, and also blending the transition between her chin and her jawline. So that's our goal for today. Before we came in the room, we had Kim apply a topical anesthetic for the last half hour that makes her somewhat numb. And I'm going to get started with the marking process.
All righty.
What we're doing is kind of getting a sense of where she's lacking in vertical length and anterior projection of the chin. And what I'm doing is marking those areas that is going to be augmented with the injectable filler Radiesse.
Is this a permanent treatment that you're doing, or will this over time have to be redone?
Generally, in an area such as this, we can expect about 6 months to a year of longevity from the Radiesse. It's not a particularly mobile area, so we get a longer longevity, I think, with Kim in this area than if we were injecting, say, the lips or areas that move more actively. All right, so we've just marked Kim as far as the areas that we plan to augment. This is a substance known as Radiesse, and it's actually been pre-mixed with a local anesthetic so that as it's injected, the area injected will go somewhat numb and be more comfortable for Kim. Radiesse is calcium hydroxyapatite. It's an inorganic matrix suspended in a gel, and when injected into the tissue of the human body, it stimulates patient's own collagen to grow on it and form somewhat of a scaffold for ingrowth. So it works really nicely as a volumizer, and in an area such as the chin, in the past 15, 20, 30 years ago, the only option would have been placement of an implant to create this. Now we can do it in a simple office setting, briefly, quickly, and Kim can go right back to her job, her lifestyle, without interruption whatsoever. So we're gaining volume in this area, and I'm paying careful attention to how much we're injecting as well. And there was 1 cc in this to begin with. Okay. I'm basically feeling along her jawline, molding it in the position, and the amount of projection that I want in different views. So what we've done thus far with Kim is added a full cc of Radiesse combined with local anesthesia to the junction between her chin and her jawline, as well as the left side of her chin in terms of projection on the left side of the midline. What I'm going to do is add additional Radiesse to this side to balance out that fullness so she has a nice symmetric area of projection.
Now Kim, as you mentioned, is only 29 years old?
Yes.
Okay, so in a person who's maybe older, in their 50s or something, if they were to have the same procedure done, does it also correct maybe wrinkles or something in the neck area? What can it also do?
Well, by putting more tension on the skin of the chin, you may passively correct some wrinkles that are just beneath the chin. That's correct. And also, of course, if there are any wrinkles in the skin of the chin itself, by increasing the tension on the skin from the injectable filler, it'll smooth some of those out as well. Of course, that's not a concern for Kim. I mean, she has perfect skin. And we give all of our patients also an ice pack to apply, and then they can just alternate that among the different areas of treatment so we minimize bruising and swelling.